Let's talk about sonography. Sonography is being an expert and being trained in using the ultrasound machine for various uses. So that could be for diagnosing, detecting abnormalities, monitoring the progression of disease, or biopsies as well. Sonography is a career in the UK that I recommend to a lot of people, especially if you want to go into healthcare, you want something rewarding, you also want to be financially rewarded as well, because sonography has a good salary. Let's talk about how to become a sonographer. The most traditional pathway to become a sonographer in the UK is to do it through postgraduate training. So first, you'd start off with an undergraduate degree in something like radiography, which is the most common pathway, and then doing postgraduate training and getting a certification or a diploma in clinical or medical ultrasound. So that's the most common pathways to become a radiographer first, get a few years of experience once you've qualified, and then applying for postgraduate training at a university, and you're looking for a clinical or medical ultrasound. Along with the ultrasound postgraduate training, you want to find yourself a clinical placement, because the majority of the UK universities, they want you to secure a clinical placement before you start the degree. It's not something that the universities normally provide, but there are two in the UK that do provide clinical placements. But the first thing you're going to do is get lots of experience in the radiography department, build your soft skills in teamwork, leadership, communication, and empathy as well, because sonography can be a highly challenging career, physically demanding, emotionally demanding. You might be delivering bad news and dealing with emotionally charged situations. So having a lot of resilience as well. So getting experience on the radiography department is the best way to build those skills. So when you apply for postgraduate training, you have many skills behind you and you stand a competitive chance. Sonography is a competitive career to get into. But let's talk about the other degrees that can also lead to postgraduate training. You can do an undergraduate in midwifery, nursing, physiotherapy. They all have use cases for ultrasound within those departments. Now, when you're working in a hospital, you're in a perfect place to be getting experience and also networking with the head of the radiography department to find out whether they're looking for sonographers on that department. That way, you'll be able to find a clinical placement in the current hospital that you're working in. There aren't many clinical placements around, and it is something you do have to search for and network with other radiographers, sonographers to be able to find out whether there is someone who can supervise you and whether your trust needs a sonographer. That's the best way to find out. So radiographers, you're in the perfect place to get those answers and find out whether they can secure you a clinical placement. Now let's talk about the two other pathways to becoming a sonographer. There are two new pathways to becoming a sonographer, and that is the undergraduate route or doing a degree apprenticeship. Both of them will lead you to a degree in ultrasound, and that means you can start working as a sonographer straight away. Now that seems like the perfect pathway. 3 years and you can start working as a sonographer band 7 immediately. But what's the catch? Now the majority of NHS trusts in the UK prefer you to have an undergraduate degree first, and that will allow you to be part of a regulatory body. For example, radiographers are part of HCPC, nurses and midwives are part of the NMC, which is the Nursing Midwifery Council. Having that regulation makes you more employable. If you look at the majority of sonography jobs, they will all say HCPC regulation preferred or NMC regulation preferred, and it's just that undergraduate experience as well that comes with it. Is that a big thing? Because there are so many sonographers that come from abroad, there's this direct pathway through undergraduate. How much is it going to affect employability? No one really knows. It's hard to say because we need to see how things pan out. As a new degree and a new degree apprenticeship, of course there will be hospitals who will be taking on these people through clinical placements. So surely they'll be able to provide jobs for them in the future. It's hard to say. I think it will affect employability because a lot of trusts are still adjusting to this and still adjusting to the fact that new sonographers will be qualified but won't have that regulation. But if sonographers are in demand, does it really matter? I think it does because it still affects employability. Now, if you want to work as a private sonographer or work as a locum, having that regulation makes you more employable, and having that experience that you've already got 5 years of experience behind you as a radiographer, it makes you more employable. You have those soft skills. And if it were me, I prefer to go through the traditional pathway because I don't want to be limited. I want to be able to work anywhere in the UK. I wouldn't want to have to commute long distances to find a hospital who's willing to take me. Now, I'm sure the people who take the undergraduate pathway will still have jobs available. Sonographers are in demand at the end of the day. But what is the sacrifice? You might be earning less than what a typical sonographer would earn, stand a less competitive chance, and you'll always be on a back foot compared to somebody else who's got that regulation. In the future, HCPC might take on sonography as a regulated profession. That's something that they're working on with different councils, but again, that's a government decision at the end of the day, and that could take years before that becomes implemented. What do sonographers earn in the UK? Now, once you are on training and you've got clinical placement and you're doing the postgraduate certification or diploma, you are on band 6 as a trainee sonographer. Otherwise, once you qualify and you've got that diploma behind you, you are a band 7 sonographer. in the UK. Now privately you can earn slightly more than that, and you're looking at between 60 to 80k on average, but there are jobs at a higher level. If you're an expert in that niche and you've got more experience, you're looking at the higher range. As a locum sonographer, I've seen rates between £45 per hour to £100 per hour. £100 is very rare and not common. Typically I see the rate between £45 to £60 an hour as a sonographer, but that does mean lack of job security. You're on a short-term contract covering as a temp basically. So you're covering where they need you on a short-term basis, whether that's 3-month contract, 6-month contract. But some people do that, and I've worked as a locum in dentistry for a long time, where I do 3 monthly contracts and then I take 2 months off, then 3 monthly contract. I find the flexibility and the increased pay is something that works for me, and I don't mind moving around, living in an Airbnb for a bit and then have that increased income and then take breaks as and when I need it. Good way to increase my income, also give me flexibility to travel, and it's an option that I'd recommend to a lot of people. But if you want to get into sonography, if you have any more questions, message me down below. There's so many different departments you can work in sonography. You don't have to be a generalist, you can be a specialist in obs and gynae, musculoskeletal, biopsies. So definitely look into it, and if you have any more questions, let me know.